recording today's session. We will have the session archived and made available approximately 48 hours after this event, and you'll be able to find it online at LTEN.org and the partner library. I'm going to ask, while you're in the background, if you could please mute your mics and then open them up as you'd like to speak. This way we won't hear any background noise. And as I mentioned, we love to see your faces. So if you'd like to leave your cameras on, that would be great. We understand if you're eating or prefer to turn them off, but we love to see the members. It's been so long since we've seen you. And then without further ado, I'll introduce Susanna Peck from Red Nucleus. Welcome, Susanna.
Thanks, Christine, and thanks everybody for stopping by. My name is Susanna Peck, and I work as a senior business director, looking at a senior director of business development, I should say, and I've worked at Red Nucleus for over 10 years. Prior to that, I actually worked at a couple of large pharmaceutical companies myself and served in both sales and training roles in Europe and also the US. So we've got 30 minutes together, probably about 20 for me to talk and about 10 hopefully for like Q&A. But the mics are open, the chat's open. So I guess the first question I would like to ask you is, what do you want to know about Red Nucleus? I can wait.
It's Susanna, Greg Adamson from Olympus.
Hey, Greg.
I would like to know if you have stuff, anything off the shelf that's ready to go, that's reproducible without a special project. I know you guys are excellent at special projects, but just curious to know. Thank you.
That's great. Thank you very much, Greg. Yeah, I'll definitely cover that. Super. Anything else?
So, yeah, I always appreciate the capabilities, just reminders, right? I mean, I sometimes forget that, you know, Ian's a pretty sharp guy and he's got some great stuff behind the scenes here. So if you can just kind of use this as a chance to remind us of maybe some of the tools or resources you guys have that we might not normally associate with Red Nucleus, that's always helpful for me as well.
Yep, super.
And I have a from the chat, solutions and micro credentialing or upskilling for trainers and learners.
Okay, super. That's great. Anything else? Perfect. Good. Well, I'm definitely going to be able to check off those 3 topics in the presentation. So just going to give you a quick sort of background on Red Nucleus for those who don't know that much about us. So we are a global learning agency. We are science first. So our solutions are really designed to try and boost the clinical acumen of your team. And we really want to do kind of 3 things. We want your sales professionals to be able to think strategically and problem solve in what's a very complex selling environment for many of us. To also build trust and strengthen relationships with our healthcare providers. And then also kind of the third prong to that is also to help grow empathy for the patient and to really focus on improved patient outcomes. So our core competencies are here, but I would also say there's a lot of other things that Red Nucleus do as well. We work with people's sales models, market access, compliance, software training. Basically, if it needs training, we can be your partner on it. So a little bit more about Red Nucleus. We've been in business for over 30 years. We have a global presence with 7 offices around the world, and we're now up to over 370 staff. So for those of you who have been working with us for a number of years, you'll know that you know, we're growing like a snowball at the moment, going down a hill. So what sets us apart? I would say it's a combination of being able to have happy clients and happy employees. So year after year, we're awarded the best places to work in our home state, which has been New Jersey and now Pennsylvania. And the average employee tenure is over 6 years. But how do we keep our clients happy? One of the ways we do that, obviously, is by producing award-winning training, but also routinely seeking feedback from our clients. We have been doing customer satisfaction surveys for over 2 years, and we're proud to say that we've maintained the status of a straight A student. We work with 9 of the 10 top pharmaceutical companies, and we have over 100 clients that we serve. So how do we approach learning? Well, one thing that is paramount to us is that learning is a journey, not an event. So we aim to be your strategic partner. We're solving for the long term, not just kind of the quick fix. And that's how we've developed those multi-year partnerships with our clients. And the way that we look at building solutions is...
Sorry, hang on just a second. Just hang on just a second. I'm supposed to be listening to this thing and I want to turn it on so they think I'm listening, whether I listen or not, because it's...
So I'll just step back a second. So when it comes to creating a learning journey for you, the first thing that we're going to do is define the learning objectives. So what are you wanting in terms of performance outcomes? Then once we understand the actual outcomes, we can start to map the experience. So we build on foundational learning to then layer on the product and the marketplace training, to then the live meetings, and then that sustainability training post-event. So that's what we call a learning journey. And all the way along this journey, we're looking for those areas where we can do reinforcement and measure success. Because, you know, as we're kind of building those performance objectives, we're also looking to put the measurements in place at the same time. So what do our offerings look like? I'll just quickly go through and cover high level, and then I'd love to get into some demos if that's okay as well. I know this is kind of a closed door meeting today, so I'm happy to kind of dip in and show you some of our offerings that we've worked on with other clients. So one of the foundational pieces that people are looking for with new hire training is like audio driven e-learning. So the reason why people like audio driven is it helps talk the learner through the experience. It's super useful for any kind of mandatory training, like a new hire, a compliance training, etc., where you need to ensure that the learner has basically heard and touched all the content. We use something called gating on these kind of programs. So that means that the content can't be fast forwarded. So everybody gets the same kind of learner experience. There's a second type of e-learning that is very popular right now, which is called an interactive ebook. So we take the audio out of that. It's highly interactive with lots of learning exercises within it. Self-checks and assessments, but it works really nicely because it's self-paced. So it works for a tenured sales force, and it's also really easy to update because you don't have to re-record audio. And then someone had asked about micro-learning. Now, I'll show you some examples of micro-learning when we get into the demo, but we call these high-impact topics at Red Nucleus. That's our kind of trademark for them. And these can be single topics. So the idea with the micro-learning is it has more of a just-in-time approach. So you can kind of tackle in-the-moment topics or advanced training in a particular area, or you can kind of augment this onto your traditional training to kind of draw emphasis onto particular areas. And these can be in the form of a video, a 2D animation, or what's becoming very popular right now is kind of that whiteboard approach with animation. And I'll show you again some examples of that. Good old print PDF. I don't think we're ever going to get away from that, whether it's the thing that leads training or whether it's the summary or the printable that goes along with the e-learning. There's still a lot of learners that like this approach. Obviously, easy to mark up, great for any kind of changing content. So if you're dealing with a very dynamic marketplace or guidelines, and particularly in something like oncology, NCC guidelines change like once every 6 months. So we're always looking strategically to make sure that we put the content into the right medium. So if it's something that needs to be updated, we'll probably still defer to a print PDF format. So talked about the foundational learning, and then once we've got through that, we're going to want to try and transition into the application pieces. And a format that's really good for that kind of transition of applying the content that we've learned in our modules into the real world is what we call a virtual preceptorship. So it really helps to start to get the representatives into the mindset of their job role. And they can look at customer information and case studies where the learner starts to kind of apply that foundational learning. So it kind of fast forwards, particularly with a new hire or someone who's working with a new customer. It helps them understand some of the differences in that environment. So currently we're working with a sales force who have been working with primary care physicians and are going to be calling on endocrinologists. So although they know their product, they don't necessarily know the site of care. So this is a great way for them to be able to understand the environment they'll be working with, compare and contrast the difference between a call on a primary care doctor compared to an endocrinologist, and also look at the different types of patients and the patient journey that they would be taking from primary care potentially into the endocrinologist's office. Another great application piece is augmented reality and virtual reality. We're starting to work more and more with that because it gives the learners an opportunity to really immerse themselves in the science and the patient and the disease management. And we've been putting these pieces, obviously back in the day when we were doing live workshops, this was a mainstay of some of our live workshops, but are also putting pieces into home study and virtual workshops too. Any questions? I'm flying through all this information.
Susanna, it's Rich Barron. How are you?
Hey, I'm good, Rich.
So in addition to augmented, did I hear you say also doing virtual reality?
Yes, we are. Yes.
What sort of areas are you doing around virtual reality? What does that look like? Are they?
Yeah, so recently Red Nucleus acquired a sister company called In Vivo. They are a medical education company. And so a lot of the work that we've been doing around that has tended to be on more of the clinical side of things, actually, what's the word I'm trying to think? Actually being able to manipulate and look at scientific models. But we also are able to do sort of the immersive experience too, where people are able to have something simulated, like a migraine, for instance. The other area that we're using augmented reality with as well is virtual conferences. So, particularly on the medical education side, something like an ASCO, there'd be tens of thousands of people going there and visiting companies' booths. Now we're actually starting to do some of that work within that setting, and then also are bringing it into virtual launches as well. So, but yeah, we can work on not only the high science side of it, but also kind of like the immersive customer experience too.
And I've got a couple questions.
Yes.
First of all, from Vicky, how do you make the museum virtual? And then from Lauren from Medtronic, how are the virtual perception chips simulations delivered? Are they SCORM wrapped?
Yeah, so first question with regards to the virtual museum, we've been doing a lot with basically like gems, which are triggers. They work almost like a QR code. So we're able to do things sort of on screen that people can kind of visit within a workshop. go through some structured assessments, and then kind of come back and debrief. So while we're not having the experience of literally visiting stations in a real museum, we are still able to do some things where people work individually and then come back and debrief. But yeah, the technology we're using, they're called GEMS, which are, you know, basically something that then triggers the animation or the video, if that answers that question. And then the second question about the virtual preceptorships. Yeah, typically they're put onto an LMS, but we also can build them, obviously, if you have like a custom learning app, they can go into those as well. So we'll either SCORM wrap them to sit on your LMS, or we'll work with your app company to work out, you know, how best to house them. And they can be large experiences, like the sort of the platforms that I was showing on screen, but we can also do them as smaller vignettes. One of the things that we've noticed now we're in this virtual environment is how great virtual preceptorships can actually be combined with a workshop. So you get people to do a little self-study. They go look at, you know, a site of care in the virtual preceptorship. You team it perhaps with a patient case study, and then you're actually able to then go into a workshop where you can debrief and you can actually put some skill application into the workshop too. So based on the physician you saw and the patient that they were working with, how would you call on that customer, and how would you kind of weave that patient story into a conversation? So they actually have a lot of legs. It's not just thinking about looking at it just as a asynchronous event, but it can actually be something that can come into a virtual session too.
So then I actually have a two-part question from Bill. The first one involves solutions in micro credentialing and upskilling trainers or learners. And then the second part, I believe, had to do with VR. He had a question on VR.
Yeah, yes, I did. Hi, Susan. Or Susanna. I apologize. I can't turn my camera on. My company unfortunately frowns on Zoom, and so it's a security thing. But
that's okay.
Since we're on the topic of VR, or VR, one of the areas we've explored and that we're going down the road with is for our AT, for assisted therapies, using artificial or virtual reality in clinical cases where we have surgery rooms and we ship the Oculus out. Do you have any experience in the actual development of those cases? Because the solution is pretty solid, how we distribute like I said, the hardware out to people. We've got the app all set up. We've got the surgery room set up. But do you do actual development at that level? Do you have the expertise or partners?
Yes, we do, Bill.
Okay.
So, well, first off, our staff in-house all have a clinical background in terms of medical writers, etc. We have MDs, PhDs on staff, but we're actually finding more and more that we are working with subject matter experts. So we're always happy to source that and work with subject matter experts, on a sort of an honorarium basis. Even with some of our foundational, e-learning modules, we do the same. We actually, if it's a specific, highly specialized area, we will search out the person currently working in the field to then partner with us, because they have the content, and then we're able to translate it and then write it into those case studies. So yeah, but we can talk about that more offline, Bill, if there's some specific scenarios that you'd like to sort of talk through with me. Hopefully that answers your question.
Sorry, I can't type fast enough. Yes, it does. Thank you. Thank you.
I know, I'm a talker, not a typer.
All right.
Great. Anything else? Good.
Chat's all good.
Great. Thanks, Greg. I'm going to dip into an example of this, but yeah, in terms of the sort of micro learning and the just-in-time training, we do a lot of tools for our clients. So whether it be looking at clinical studies, PIs, we love to kind of put these kind of compilations of your studies, your competitors' information. So not only does it help build the kind of landscape for new hire training, but it's also a really great tool out in the field. Again, this is something with companies who have their, their apps and, representatives are able to kind of go back and look at training as resources. These kind of matrix tools are really super helpful in terms of supporting the pre-call planning of the representative. And then lastly, I'll just touch on workshops. So we have kind of 3 tenets around workshops. They're going to be easy to facilitate, maximum interactivity, and continued reinforcement throughout the workshop. Now, obviously, gamification has become more and more important, I think, to try and work out how to make those workshops interactive. So Red Nucleus does have a gaming platform called Arcade. We're able to do single user games. We also are able to put a competition peer-to-peer in there. So it can be something that's done asynchronous, but it also can be something that can be a competition in a team setting in live training too. And then just to say, even though we don't have a lot of people in the office right now, we do have in-house production, so we can do all your audio and video work. Great team of 3D, 2D animators and certified medical illustrators. Not just illustrators, but we have a team of actual certified medical illustrators, which is a pretty specific degree. And then lastly, QA. It's all, the reason you use a vendor is you want your med legal submissions to be clean. You want to kind of like wash your hands of that and just, let your vendor put in something that is clean, is going to get smooth reviews. And I would say we're best in class in terms of quality assurance. So I have got 5 minutes. So I was quickly going to go over and show you a couple of things in our...
One quick question from Bill, if we could, Suzanne, I apologize. Your Arcade app, can it be positioned in the existing infrastructure as our microservice via modem API?
Yes, it can. Yes. It can. It can basically, it's a website. So it would actually, you'd have in your custom app, you'd just have a link and it would call out to that. So yeah, it can be housed anywhere. It could be on a SharePoint, in an LMS, in an app, or you can just use our site as well. So it's very, very flexible.
Is that outstanding? Thank you.
Great. Okay. So can you see my screen?
Mm-hmm.
Okay, so what you're actually looking at now is something called Unify. It's Red Nucleus's content management system, and it sits on top of an LMS. So, when you go into the LMS, you're searching forever to try and find the program unless it's pushed out. This is a way we serve up content. It's completely customized to our clients' needs. But I was just going to show you a couple of things within here to give you a sense of some of our offerings. So I'm going to go into some of the micro learning now. Just taking a minute because obviously it's going through. It's going through Zoom. Oh, don't you love it? All right, it's really having to think here. All right, let me see if I can go in this way. So this would be an example of a high impact topic, and I'm just going to make sure that you can see it before I let it run. Okay, so I'm going to reshare just to make sure you're seeing it. Okay, good. Can we see sweat on a screen?
We can.
Fantastic. Okay, so this is an example of one of those high impact topics I was mentioning. So this is the biology of perspiration. And I always laugh about it because, you know, whenever I'm presenting, I'm like, how ironic, I'm talking about sweating while I'm actually presenting. But the idea of this is it's really just answering the one question, like, why do we sweat? So you can see this is a little bit of whiteboard animation. So you can see we're describing, you know, hypothalamus, putting it in really simple terms. So it's your thermostat. And then we have the audio over the top, and then we sync up the content on screen as it builds. So we're going through, there's some key points here you can see are pulled out with the icons. And it's just this sort of very nice way of being able to go through more and more kind of complex information, but kind of breaking it down into chunks. So now we've gone literally from looking at someone on the dance floor to getting to the point where we're, you know, looking at, you know, the sympathetic nerves. And this piece of e-learning literally takes, I think, about 3 minutes in total. And then we have the summary. And again, if you wanted to always put sort of have this as a printable as well within it, you know, it's a great way to produce a very simple, highly engaging piece of e-learning. And again, you know, it can be plugged in to a home study, but it can also go out as sort of a review piece as well to tenured folks. So that is one example. Anything else?
Susanna, we're just about out of time, but I did have another question come in through the chat. And it was, can you talk about your relationship with LSTI? Specifically, are you able to customize the OTS offering?
Yes, good question. So yes, LTSI is part of Red Nucleus. We are working right now to we're reviewing and updating all of their off-the-shelf content. We will have a huge portfolio of off-the-shelf offerings very shortly. Right now, we have a lot of like fundamentals programs. So we have like fundamentals of pharma, we have oncology 101, we have a lot of market access materials that are all off the shelf. So they're basically plug and plays. And if anyone would like sort of a list of all of the offerings currently, I can share that with them. And there's definitely ... more coming soon.
Great. Thank you.
Any other questions?
Okay, well, I think we are just about out of time. Thank you so much, Susanna. This has been incredibly informative. And if anyone has any additional questions for Susanna, you can find her via the LTEN website, searching for her contact, or you can just reach out to Greg or myself and we will put you in contact with Susanna. So thank you all for your time. And thank you so much, Susanna. We appreciate it.
Not at all. Thanks so much, Christine. And I'll see you at the grocery store. We're neighbors.
Yes. Thank you.
Cheers,
All right. Have a good one.
Great. Thanks, everybody. Bye.
Bye.